Changes are coming to how Connecticut handles health care for sick children. 100 more families are going to be able to care for their kids at home thanks to an expansion to Connecticut's Medicaid program for medically fragile kids. News 8's Kent Pierce is live in New Haven this morning with the details on this expansion. Good morning, Kent.
Good morning, Allie, and that's an interesting phrase, medically fragile kids. What does that mean? We're talking about kids who are very sick but don't necessarily need to spend all of their time in a hospital like Yale New Haven Hospital. They can be cared for at home. In many cases, should be cared for at home. That's preferable, but that is very expensive. And we're talking here specifically about families that make too much. Their income is too high to qualify for Medicaid, but it would be financially ruinous for them to try to pay for all their child's medical expenses for that home care. So what there is something called a Katie Beckett waiver. This is a waiver for the qualifications for Medicaid. So families who do have incomes too high to qualify for Medicaid can get a waiver and get Medicaid to help them care for that sick child at home. It's named after Katie Beckett, who did exactly this. She was a child in Iowa in the 80s. She got care at home instead of in a hospital and got this waiver. So this has been going on for a while. It's a federal program. Federal government and state money goes into it. It's existed for years in Connecticut, but it's always been capped, or most recently been capped at 200 families. This expansion now allows another 100 families to take part in this. Good news, because there is always a waiting list for this particular service. We're live in New Haven this morning. I'm Kent Pierce. Back to you.